What are the signs of generalized anxiety disorder? Picture this. You're getting ready for a fun day out with friends. You coordinate when and where you'll meet up, what you'll do, where you'll go for lunch, but then you think, what if your car breaks down? Your car seems fine. It's shown no signs of failing, and you take it in for regular maintenance, but you can't get that thought out of your head. All day long, while your friends are laughing and enjoying themselves, you can't stop worrying about what you'll do if the car breaks down and all the bad things that could potentially happen if it did. It can be normal to feel stressed out now and then, especially over common worries like your job or relationship, but if you're experiencing anxiety on a regular basis and for little or no reason, it could be a sign of generalized anxiety disorder. Hi, I'm Sunny Williams, LPC, a licensed therapist with BetterHelp. If you or a loved one experiences persistent feelings of anxiety and are looking for answers on what's causing it, stick around. In this video, we'll cover common signs and symptoms of generalized anxiety disorder, along with potential causes and treatments to reduce symptoms. But first, let's define what an anxiety disorder is. About anxiety disorders. As I mentioned before, feeling stressed or anxious on occasion can be normal. But being in an extreme or constant state of anxiety that's impacting your daily life could be a sign of an anxiety disorder. In addition to generalized anxiety disorder, types of anxiety disorders can include panic disorder, social anxiety disorder, and phobias. It's important to remember that although these disorders are often chronic, there are many treatment options available to successfully manage conditions, improve symptoms, and help individuals with anxiety disorders live full, healthy, and happy lives. Now, let's take a closer look at generalized anxiety disorder. What is generalized anxiety disorder? According to the Anxiety and Depression Association of America, generalized anxiety disorder, also known as GAD, involves persistent, excessive, and unfounded worry that is experienced on more days than not for a period of at least 6 months. In essence, it entails a persistent feeling of dread without any discernible cause. Oftentimes, these feelings of constant anxiety can get in the way of completing daily tasks and can affect your ability to live a normal life at home and in the workplace. One of the most notable aspects of generalized anxiety disorder is that although feelings of anxiety may seem like they're tied to specific tasks or concerns, the anxiety persists even when those tasks are completed or concerns are resolved. The feeling of dread may also seem linked to a potentially life-threatening or traumatic event, such as worrying for family members' safety. However, it often stems from insignificant triggers. When these triggers occur, individuals with GAD may abruptly experience inexplicable and persistent anxiety and tension, entering a cycle of distress and worry, regardless of the initial trigger's actual significance. Now that we've defined what generalized anxiety disorder can look like as a whole, let's break down some of the individual symptoms someone with GAD might experience. Signs and symptoms of generalized anxiety disorder. It's important to note that generalized anxiety disorder presents differently from person to person. However, some common mental health symptoms of GAD can include persistent and obsessive worrying, feeling restless or on edge, worry or dread that's out of proportion with what a situation realistically calls for, difficulty concentrating, inability to make decisions, or suicidal thoughts. If you or a loved one is experiencing suicidal thoughts, reach out for help immediately. The National Suicide Prevention Lifeline can be reached at 988 and is available 24/7. Generalized anxiety disorder can also result in physical health symptoms such as fatigue, irritability, muscle tension, trouble falling or staying asleep, trembling, sweating, irritable bowel syndrome, nausea, or other digestive issues. Headaches or unexplained pains in the chest, abdomen, and muscles. If you're experiencing persistent physical symptoms, consider reaching out to your primary healthcare providers. They can conduct a thorough physical exam to determine if there are any underlying physical causes contributing to your symptoms. Potential causes of generalized anxiety disorder. So what causes generalized anxiety disorder? The consensus is that there isn't one universal cause. GAD tends to begin gradually, often in childhood or early adolescence. But like many mental health disorders, certain circumstances and risk factors contribute to its formation, such as genetics or a family history of anxiety, personality traits such as a tendency toward perfectionism, pessimism, or chronic worrying, being in a stressful environment, exposure to traumatic experiences, brain chemistry, which can influence neurotransmitter activity and brain structure, biological sex, as females are twice as likely as males to be living with GAD, and age, because according to the National Institute of Mental Health, 2.2% of adolescents and young adults in the U.S. will experience GAD in their lifetimes. The level at which each of these risk factors and causes contribute to generalized anxiety disorder is unclear. However, being aware of them can help diagnose the disorder and determine plans for how to treat it. Treating generalized anxiety disorder symptoms. Because of its severity, generalized anxiety disorder is often not something you can tackle on your own. It usually requires professional treatment to overcome or control so that you can return to a more balanced emotional state. Living with GAD without effective coping mechanisms can lead to a greater sense of hopelessness. For this reason, individuals with GAD are at a higher risk for developing comorbid conditions such as depression. That said, if you or a loved one is diagnosed with generalized anxiety disorder by a licensed professional, there are many methods that can help treat it, such as therapy, medication, and lifestyle changes. Under professional guidance, these methods can be used separately or together to create a personalized treatment plan to effectively manage symptoms and improve overall well-being. One of the most effective and widely used treatments for generalized anxiety disorder is working one-on-one with a licensed therapist. Talk therapy can include a variety of psychological techniques, including cognitive behavioral therapy, or CBT, and exposure therapy with whatever the source of anxiety is. These methods help individuals face what they're anxious about in a controlled environment and attempt to transform anxious thoughts into positive ones. What are some effective ways you manage anxiety in your own life? If you're considering reaching out to a therapist for personalized help, online counseling through platforms like BetterHelp can be a less stressful and convenient way to get started. For more information about anxiety disorders, check out our video on 3 things about anxiety disorder you should know. And if you found this video helpful, remember to like, subscribe, and turn on notifications for more tips on improving your mental health and well-being. Generalized anxiety disorder can feel all-encompassing, but it doesn't need to take over your life. And if you are not alone in your journey to overcome it, just being here to learn more about this condition can be the first step towards successfully managing your anxiety. So thanks for joining us today. Take care, don't forget to subscribe, and we'll see you next time.